You have to keep these two focal onset seizures very specifically for your exam, because each facts which I am about to tell you can come as question in exam. Okay, so let's take up first simple partial seizure. Now it is termed as focal onset without discognitive feature according to new classification. Okay, so simple partial seizure. What is simple partial seizure? First, you have to remember that it can never be a part of epileptic form syndrome. Epileptic syndrome, never a part of epileptic syndrome, because it means that you cannot have an epilepsy that is presenting to you with simple partial seizure. Okay, because always and always it will definitely have a cause, like focal issues like huge stroke, ischemia involving more than 1/3 of brain. Number 2, tuberculoma. Number 3, trauma, where there will be alteration in brain. Number 4, neurocysticercosis. So you are seeing that there must be any focal issues or cause to cause simple partial seizure. It is never a part of epileptic syndrome. Always it will have a cause behind it. Okay, second feature is intact awareness. Patient will not lose consciousness throughout the seizure episode. Okay, number 3, if you take an EEG after the episode, it will be perfectly normal. So interictal EEG comes as normal. Number 4, there will be no post-ictal confusion. Okay, so these 4 features you have to remember very specifically. I am telling you repeatedly, these facts will come as questions. Each and every facts may come as questions in NEET-PG. So simple partial seizure, now termed as focal onset without dyscognitive features. Okay, it can never be a part of epileptic syndrome, means you cannot have an epilepsy that is presenting to you with simple partial seizure. Always it will have a cause behind it, like focal causes like huge stroke involving more than 1/3 of brain, tuberculoma, trauma, neurocysticercosis. Patient will not lose consciousness throughout the seizure episode. So there will be intact awareness. Interictal EEG will be normal, and there will not be any post-ictal confusion. So whenever you are thinking of simple partial seizure, you have to keep these in mind, because they are repeatedly asked in exams. These are number 1, Jacksonian march. Number 2, Todd's palsy. And number 3, epilepsia partialis continua. Okay, actually these are 3 essential things which actually define simple partial seizures. Okay, you have to look for this. These may present, may not be present, but these are repeatedly asked in questions. Okay, what is Jacksonian march? It's predominantly seen in upper limb. Movements are started distally, then slowly going proximally, like marching gradually from distal to proximal, Jacksonian march. Todd's palsy, very rarely seen. What is palsy? Todd's palsy, post-ictal transient weakness, mainly seen in upper limb, may be seen in lower limb. Okay, post-ictal transient weakness of upper limb greater than lower limb. Okay, it usually lasts for 1 to 2 hours, but can last for 12 to 24 hours max, usually 1 to 2 hours. Okay, now what is epilepsy partialis continua? It is continuous simple partial seizure lasting for more than 24 hours. Okay, Todd's palsy usually persists for 1 to 2 hours. It can persist for 12 to 24 hours post-ictal transient weakness maximum. And what is epilepsy partialis continua? Continuous simple partial seizure lasting for more than 24 hours. This is the term you have to remember, more than 24 hours. And you have to remember one thing, it is generally refractory to drugs, rarely seen, but it can be asked, and it is very very important. So these are three essential things which usually define simple partial seizure, and you have to remind all these three things. These are very simple facts. And one thing I have forgotten to tell you about, that simple partial seizure, a person while having this can or cannot have aura. It is a subjective sensation. Okay, it can be motor, not motor, wrong. Patient can have aura, cannot have aura. Okay, and it is a subjective sensory or psychic phenomena. It can be of three types, like paresthesias. Patient can see flashing light before onset of the episode, or it can be of autonomic symptom like bladder and bowel involvement. So this is the simple partial seizure. Thank you.